Hey guys, it's Hina Chef here at Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania. And today on Dang, That Sounds Like Me case history, we are going to be talking about a young male who's been suffering really badly from symptoms of what he feels like is a fist. This is how he describes it, a fist on the inside of my pelvis pushing down onto my perineum. Perineum is the saddle area. And so for those of you who haven't heard of this, what is Dang, That Sounds Like Me case history? It's just where I basically describe any of the consults or the patients that I've recently seen that seem like this seems kind of bizarre. We're not sure what it really is, but it ends up being a musculoskeletal issue. And the reason why I like to do these is because I know there are tons of you out there that have very, very similar symptoms, and you're running around like a chicken with your head cut off, going from one practitioner to another, and you can't really figure out what's going on. And so hopefully, if this sounds like you might be able to resonate with it and see if this could be a muscle issue. So I am not going to be looking at the computer screen today. I'm actually going to be taking a look at my notes and telling you about it, because this one's a little long, okay? But it's a good one because I know that there's many of you out there like that. So now this was a young male. He seems like he's in his mid-30s. I recently did a consult with him. He doesn't live in this area. And his symptoms all started, what he feels like was, in years ago, probably like pre-COVID, so maybe in 2019, where he was at the gym, he was doing a lot of activities, and then all of a sudden, for some reason, he started having a lot of discomfort pretty much all day, where it felt like, he's like, I felt like there was a fist pushing on the inside of kind of his like rectal kind of perineal area. And he's like, it feels like it's a fist that just pushes down and just gives me all this pressure. And he talks about, he went to his primary doctor. They gave him antibiotics. The antibiotics actually, weirdly enough, helped him while he was on it for 10 days. But then as soon as he went off of the antibiotics, all of his symptoms came back. And he was a little bit of a gym rat, so he wanted to go back to the gym. And he noticed, hey, going back to the gym, I'm starting to have symptoms again. So then he stopped going to the gym. And then, he started having like prostate issues, where he started having what felt like prostate pain. And so again, he went to his urologist. They gave him some more antibiotics. This time, again, they may have helped. They kind of didn't help. He's like, I don't know if they really helped. But then again, that prostate kind of infection pain then still contributed to this heaviness that he was feeling. And he's like, the prostate pain kind of sort of like came and went. He's like, but this heaviness where he felt like that pushing from the inside would just continued to be there. And he's like, so I was actually, I went and had an MRI. I had all these lab tests done. Nothing was coming out. He goes, and then I was told to actually go and see a pelvic floor therapist. So he's like, so in my area, I went and saw a pelvic floor therapist. They did, stretches. They did some what's called E-stim. They kind of taped my tailbone. They did breathing exercises with me. And they also did something called internal pelvic floor therapy work, which is something that we also do at our clinic. But he goes, I had all of that done and nothing was quite really improving my pain. And he goes, and so I'm not really sure kind of, if that was supposed to help or it wasn't. He was also on nerve medications, which he was like, the nerve medication wasn't really doing anything. He was on something called gabapentin. But he ended up changing to another nerve medication called duloxetine, which he does feel like is helping. He also went and actually had several injections. He went and had a low back injection. He went and that didn't do anything. He also had 2 injections in a nerve called his pudendal nerve. And that didn't do anything either, because he's like, sitting definitely makes my pain worse. And usually when sitting makes pain worse, one of the things that people think of is something called pudendal nerve issues. But he wasn't even having, that didn't even help him. But, I did probe him more in terms of, okay, you're sitting, but is that really reproducing something that seems like pudendal nerve pain? And he's like, and once we talked about it, it kind of wasn't. He wasn't really having this pudendal nerve pain. He even went and had something called a chromosome shot, which I don't even really know what that is, but he's like, that didn't do anything. He was on muscle relaxants. That didn't really do anything. And so on and on and on. We even dove into more of history of, you know, his bowel, his bladder, his GI system, all of which was normal, which is a good thing. So at the end of the day, we went through all of this and nothing was helping him. And he's literally like, I'm at my wit's end. I've had everything done, from pelvic MRIs to regular MRIs to back MRIs to all these injections to physical therapy. Nothing is helping. And so once we went through this entire history, what I figured out is that, okay, all of this pain actually started with him doing a workout at the gym. So even though he had all this workup done, which is, you know, like I said, a good thing that he does have this workup done, because at least we can rule everything out. This is still what I'm going back to. There was a workout that he did at the gym. So we really talked in depth about his workout and what he was particularly doing. And what we figured out is with his workouts, there was a particular movement that he was doing that was triggering potentially certain muscle groups that does sometimes mimic pain that he's talking about in this area. And so now what we're doing, he's actually going to be coming in and we're going to check all this out. We're going to do a thorough exam on these particular muscle groups that may be creating the problem, because when he did physical therapy, and he did it twice, that physical therapy didn't particularly look at what I want to look at, and the particular muscle groups that we want to look at. So this is why doing a really good, thorough history, really looking at someone's workout program, talking to them about, you know, what specific exercises they're doing. And then for me, thinking about what muscle groups are being incorporated when you're doing that particular exercise. That is really, really important. That's why history and really understanding what's going on with someone is really important, because we have a feeling now, we know what's going on. And so hopefully working and evaluating him and working on this is going to start getting him on the right path to getting better, since nothing else has worked. So for those of you who might be having a similar type of problem where you've gone and you've seen all these doctors and nothing really is helping, and you're kind of like, you know, it started out with something at the gym, but then it's kind of like exploded into something that I don't even understand and doctors are not understanding anymore. And I've kind of just been like passed along from one practitioner to the other. And maybe you've already seen even physical therapy, right? But maybe it wasn't honed in on specific things. Then you might need, this is what you still might need. You're probably right there. You're probably close, but you just need some help in really figuring out what the next step is going to be. So hopefully you can relate to this video. Hopefully it's empowering and helpful to you to know it's not something crazy bizarre. It might just be still a muscle issue. It's just we need to dive in deeper to really figure out where those subtle nuances and imbalances are, that is going to put you on the right path. So if this was helpful to you, if this case study was helpful, like the video, subscribe to our channel. Any of our information, if you live in and around this area, you want to come see us, rebalancept.com. We have all of our information is in the description box below. If you don't live around here and you want to do a consult with us, again, my link is down below where you can do a consult with us. And other than that, I hope this was helpful to many of you, and have a wonderful day. Take care.